Good afternoon, everyone, and welcome to another episode of The Kickback. I am your host, The Dude. As we do every Tuesday, we have an amazing conversation with amazing people. And today we have Dr. Craion, and it's going to be another amazing conversation. Dave, how are you doing tonight, my brother?
Man, we are doing wonderful, wonderfully blessed on this great evening, this pre-snow evening.
Yeah, they're talking about snow. What do you think
Yep, it's
about
supposed to
that?
come in tonight I guess it's going to come in after midnight tonight, but they've already canceled school for tomorrow, right?
Yes, sir. They've already canceled school for tomorrow. And Clarksville, it's already snowing in Clarksville.
Yeah, anything north of us is going to get hit harder. We're at the bottom end of the snowstorm, and south of us is just dusting.
Yeah,
Closer
but
to the Alabama line, they'll get a dusting, but we'll.
hello, sir. How are you?
Still connected,
Yeah,
Good evening. How are you guys doing?
we're doing wonderful,
Joe?
wonderful. Yes, I'm still here. Can you hear me, Dave? Hello? Can anyone hear me?
Yes, I can hear you now.
I can hear you.
All righty. Welcome to the show, Dr. Craion. I am the host of the Kickback, the Dude, and of course, you know Mr. Dave.
Yes, I do.
All righty. How's your night going thus far?
So far so good. Just trying to stay warm like everybody else.
That is it. That is it. So here at the Kickback, we like to have honest, transparent conversations about life, love, or whatever your particular field of expertise is. But it's a place for brothers to have open, honest, and vulnerable conversations. What I like to tell all my guests is this. I like to do my show like a mullet, business in the front and party in the back. So what I mean by business up front is tell us about you, where you're from. Actually, I see where you're from with the phone number, but
Yeah,
let's talk about who you are, where you're from, what are you doing in life, and family.
gotcha. Okay. I'm born and raised in Detroit, Michigan. I am currently a primary care doctor, family practice medicine doctor here in Nashville. Just recently joined Nashville General February, so it's been about a year since I joined up with them. Let's see, what else do you want to know? Oh, you said family. Just uh, really supportive family. Thank God for them and what they mean to me. Um, but as a family doctor, sometimes you feel like you don't have the time that you may necessarily need to like focus on them and spend time with them because your time is so divided. So just thankful for a supportive family. I would say that right off the bat. Um, So let me say I've been practicing for about 10 years. Did my residency in St. Louis University, just outside of East St. Louis on the Illinois side of things. Other than that, just trying to enjoy life as I can, trying to stay true to what God has laid out for me, the doors that He has opened up for me. Um, and then just trying to find a way to help someone. I thank God that I have a job that allows me the opportunity to help someone every day. So that's what I hope to bring to this table today.
Wonderful, wonderful. So you said you've been practicing for about 10 years. You sound very young.
I'm a little bit older than what I sound like, but black don't crack. So we got that working for us.
Right, right. All right, so you said you're a family practice doctor. So explain to people what that means in
You
layman's
still there, Doctor?
terms.
Yeah.
for technical
So
difficulties that people may.
basically, in layman's terms, easiest way to describe what I do is basically I can treat anybody from cradle to the grave. And we mean that literally. The family medicine doctor is trained to care of newborns all the way up to the elderly. So literally, I can see your whole family. The expectations are high on us, and the fact that whatever comes through our door, about 90%, we should be able to treat or at least refer to the right person. So we may see something straightforward, like, well, at least straightforward for us, treating someone's high blood pressure, their diabetes or blood sugar issues. They may have asthma, just to a straight physical for work or something like that, or even a little bit something more serious like dealing with anxiety or depression. So we cover a wide range of topics, and that's one of the draws of family medicine that caught my attention was the myriad of things that they can help people with.
Okay.
Another way to kind of describe what we do is kind of think of us as decathletes of medicine.
Okay. All righty. So you guys, so like you said, you guys literally treat you from the cradle to the grave.
Correct.
All right. And you see, you just joined a general hospital. What is that like?
So that is a little bit different. I've been in Nashville about 8 years now. So, General does not have the best reputation in the community. I can let you know that up front. Um, you know, um, I think that comes with um, the nature of being the city hospital, where you catch any and everything that comes from the community, where you are the safety net. So the pressures are different if you're as compared to a bigger institution, let's say like Vanderbilt or Ascension St. Thomas. You get all the glitz and glamour on one end, but not necessarily better care. I think that's an interesting component, realizing that medicine is medicine, independent of the institution. So I think that's one of the biggest things I noticed since coming over to General. I know they've done some things to kind of definitely improve, like the reputation um, in the community, such as like something like a food bank, which I think is really important. I think it addresses a big need in the communities, such as communities that may have a food desert. That's one of the things I was pleasantly surprised at, just allowing people access to like fresh produce is a really big help, and it takes the burden off whether or not you're going to pay your rent or you're going to pay for your food.
Yeah, I've watched that on the news and saw that they were doing that, and I thought that was very wonderful. Now I am a Nashville native, so I was born at Meharry Hubbard Hospital, which used to be the name of General Hospital.
Gotcha.
So the reputation changed once it became Nashville General, but Meharry Hubbard Hospital had a much better reputation, and it was really known as the hospital that black people went to because it was in our neighborhood. So a lot of times we went there. And around the corner, you all's neighbor is Matthew Walker Comprehensive Health Care. And
Uh, Correct, on Jefferson, yes.
yeah, they are. They played a big part in the African American health because they did it on a sliding scale, which they still do now, to do certain things. So let's get into the meat of it. How many male patients, Black American male patients, do you see on a regular?
I would probably say probably on an average day, we'll say 5 to 6, maybe on lower end, maybe 10 at most. But definitely as far as who's coming in, um, definitely our female counterparts are more likely to come in to get their needs addressed. I know I do have African American patients who will come in just specifically because I am a black male and they want someone to take care of them that looks like them.
Right. Right.
Yeah. So
So,
I think that's a fair number, like 5, 6 low end, maybe 10 at the most per day. I see about 20, 25 patients on a normal day.
okay, the percentages on that is not bad. What is the biggest health issue that's plaguing African American men right now?
I would say, as far as health disparities, blood pressure and diabetes would probably be the top two. The chronic conditions, I think, are right at the top of the list. And the
Okay.
main issue is that because we can't feel those things, like you can't feel your blood pressure, you can't feel your diabetes, um, things just kind of go along until it becomes critical. When something pops up, like you're not feeling well, you're keying it all the time and you're trying to figure out, hey, what's going on? I don't feel good. And then that's what drives you to the hospital. And that's how a lot of people find out. So
Right.
definitely I would say those two things at the top of the list, hypertension, diabetes. And then if I had to say a third, I would probably say even under addressed, particularly men of color, it would be like mental health issues, either anxiety or depression, like finding ways to deal with that.
Okay. I mean, and that's because we weren't taught that mental health was something that was a top priority on the list, much less anything when it comes to our health as men, and especially as African American men. It is, going to have your mental health checked on is frowned upon in some circles, but I think it's really important in these days and times that we make sure that our mental is just as sharp as our posterity or our man parts, because we'll worry more about our man parts than we will about our brain.
100%. I kind of have this running joke. Two things will get a guy faster into the office than anything else. Number one, let his feet hurt. Number two, let there be some erectile dysfunction issues. Those two things will drive a guy in quicker to the office than anything else.
And
Because
why
they'll,
is it? Why is it the feet?
oh, they don't like to have their feet hurt. Trust me. Hey, people, guys, they're working long hours, 10, 12 hours, and they feet hurt. They'll come in and say, hey, doc, something's going on with my feet. And you're looking at them, you're looking at their blood pressure, like, okay, I can help you with the feet real quick, but I really need to address your blood pressure. Like, hey, what did you have to eat? Like, what's going on here? Um, so I think we're making light of it, but that's a real concern
No,
in regards to getting African American men into the doctor to see the doctor. Another thing that I will say when I usually talk to particularly men is like we know more about our cars than we know about what's going on with our own bodies.
very true.
And I think that's a sad truth, but I think it is a truth. Um, you know, just one the making it a priority to have one a primary care doctor and two to go see that person on a regular basis. We shouldn't have to have our wives or girlfriends drag us to the doctor's office to come to the doctor and to have that honest conversation about what's going on with us. And I see that
True.
a lot too.
I love my primary care doctor. Me and him are about the same age. And the reason why I like going to my primary care doctor is because we can have real man conversation before we get into any diagnosis or anything going on. They do the preliminaries before you go into the room, check your weight, check your blood pressure, check all those things. But his nurse does those things. But once he steps into the room, it's how's your family, how's your wife, how's your kids, how's life going, and we have those conversations beforehand, and then we go into the diagnoses of whatever's going on with me. And he made me feel, I've been going to the same primary care doctor for the last 3 years, and he made me feel so comfortable that I can actually have any type of conversation that deems imperative at the moment, or if there's not anything imperative at the moment, just to say, hey, everything's okay. I feel good. I've had a few headaches here and there or whatever. But what, in your opinion, as a doctor, you said, a man's feet and erectile dysfunction will bring a man into the doctor really quickly. What is it, in your opinion, that you think that's not bringing men into doctors' offices?
Gotcha. So one, not making a priority. I think that's number one. We get busy with life. There's a lot tied into our manhood, particularly men of color, into what we can bring to the table, what we can bring into the household. So if we're not able to provide financially, you got like, hey, I got to make the hustle. I got to bring bills, get the bills paid, make the wife happy, take care of the kids, do this, do that. So we get caught up in that type of rat race, and our health will suffer. Two, like I said, if you can't feel your hypertension, you can't feel your diabetes, you're not going to be too concerned about it. We don't take the time like we're doing now to like talk about our health, whether it's physical or mental health. If you're in a barbershop, no one's talking about health. They're talking about, who's the GOAT, Jordan or LeBron. That's
Very
going to
true.
drive the conversation. So one, I would say making a priority. Two, not knowing our own family history, at least health wise. That's an important thing to know because that dictates like what's, down the line for you. Talking to pops, talking to your uncles, talking to your brothers about, hey, what's going on as far as like your health. It doesn't necessarily have to be chapter and verse, but like there should be some level of conversation like, hey, this is what's going on with my brother, or this is what's going on with my dad. Because oftentimes when I talk to people, they have no idea what's going on with the other relatives in their family, and it shouldn't be that way. As far as the like specifically about the feet and the ED, they can feel those things. They get feedback about that. If your feet hurt, your feet hurt. If your girl mad at you because you're not performing, or you notice you're not having the same stamina like you used to, you're gonna notice that too.
That is a great conversation. So, what can lead to erect? What are some of the major causes or foods or whatever
Mhm.
for that causes erectile dysfunction?
So I would say not primarily, diabetes would be one, because when you have blood sugar issues, you can have decreased blood flow to different parts of the body, and it also damages the tiny blood vessels in our body as well. So that definitely can affect a man's ability to have an erection, or even to maintain hardness when it's time to be intimate. So that's one. There are medications that could affect it, including blood pressure medications, would be one. On a side note, Viagra was originally started off as a heart medication. But once they figured out that this actually caused men to have a firmer erection, they switched over to erectile dysfunction medication.
Hey,
Just
you
as a
learn
funny side
something.
note.
Hey, you learn something new every day because I never knew that, and that is a funny side note. It started out as a heart medication, but then once it gave a man a firmer erection, hey, we can make more money because a man, like you said, a man will spend more money on his feet and his posterior than he will anything else. Because for years, and I'm on a weight loss journey, but for years, my biggest thing was I got to have comfortable shoes on my feet. It didn't matter what they
Right.
cost. Didn't matter what they looked like, as long as I could stand. Everything you said is true. As long as I could stand on my feet as long as possible, and these shoes didn't make my feet hurt, it didn't matter what the cost was. I was going to spend the money. It's like the shoes I have on now. They're a pair of Nikes, but they have the big bubbles on the bottom of it, so it's like you're walking on a big cushion of air.
Gotcha.
But they're really comfortable shoes. Now, being that I've lost 100 pounds in the last 2 years, I feel a little bit lighter, and I feel, I'm experiencing some different things in life. And as I say, we have honest and transparent conversations. I lost 100 pounds in 2 years, and my stamina has went all the way up. The wife enjoys life a whole lot better, let's just say that, since I've lost 100 pounds.
Gotcha. Well, first off, congratulations. Like I tell anybody, any amount of weight that you can lose is a plus for you. Um, Typically, when it comes to weight loss, since we're kind of on this topic, always ask people how much weight they want to lose, and then they give me a number. And in actuality, the reason why I'm asking them that is because people pick a number for a reason. So it actually becomes not necessarily the physical weight, but what's actually weighing them down. Like, do they want better intimacy with their partner? Do they want more stamina? Do they want less back pain, less knee pain? Be able to play with their kids without feeling tired and run down. So those are the things I want people to focus on any type of weight loss journey. Those benefits, and that's going to be independent of what the number pops up on the scale. So that's the approach I take when I counsel people on weight loss and so forth and what their goals are. Like why you pick this number, what were you actually trying to achieve? But definitely any weight loss is a plus. You're definitely going to feel the difference. In your instance, your wife is more happy, probably because you're going to guess to say you're a little bit more easy to be around with the weight loss. Like you
Yes,
don't feel
sir.
like you're a drag.
Yes, sir.
Okay, gotcha.
Yes, sir. Yes, sir. Yes, sir. But nobody ever mentioned. My doctor didn't even actually say it in the manner that you said it, and that's pretty interesting. And that's a great way of leading into a conversation about weight loss. And it made me think, yeah, the reason why I wanted to lose weight is because I have two small children. One's 14 and one's 8. And I want to be around for them a long time. And one of my older children, she just announced that she's pregnant. So I'm about to be a grandpa for the
Okay, all
first
right,
time.
all right. Congratulations again.
Yeah, so I want to, I want to be around and see these people grow up and see who they become as adults or people, just growing up, because I'm a product of a single parent home, and my dad wasn't really there a whole lot. He was, he was sporadic, like a lot of us in the African American community. We grow up with a sporadic dad. He's there when he's there. He's not when he's not. So I made a vow to my children when I had my first one that I would not be that sporadic father. Now, the relationships between me and their mothers didn't always work out, but once we separated, we became good friends. And so, like my two smaller children, me and their mom, we have a wonderful co-parenting relationship. I'm married; she's married now. We have a wonderful co-parent relationship. So, I get to see, I get to see my children whenever I do, and I like to keep up with them because young children are full of energy, and I wish I could just extract just a
Bottle it
little bit
up.
of that. Yeah, just bottle it up and just take a sip of it every day and just, see if I can run around like that.
Gotcha.
So what about, let's say, people that eat from like eating cheaper food from, like, let's say the Dollar Tree or the Dollar General? What kind of is that food any good? Does it have any health benefits?
So when it comes to food, I think the kind of one of the how do I want to say this? Okay, so um, basically the supermarket is kind of structured like this, and I picked this up for one of the doctors I used to know back home in Detroit. Everything on the perimeter that's like perishable is probably the best for you. So that's your fruits and vegetables, like your bread. Everything on the shelves with the high sodium content to keep it fresh out there is probably least of value for you as far as food. We talked a little bit earlier about food deserts, and then sometimes like the stand-in will be like the Family Dollar or a store like that, where you have food items, but because they have to be on the shelf, you don't know how long they'll be on the shelf. The preservatives may have a higher concentration inside those foods, so they probably won't be the best for you. They tend to be more sugary, those type of things. So 100% correct. Those foods may not be the best choices for you. What becomes difficult at times is reading the labels, because sometimes they'll put the label and they'll say like, this is how much of this particular item, let's say sodium. This is the sodium content in this item. Let's say it's like 100, just to make the math easy. Well, realizing it may not be the whole entire box that's 100. It may be per serving. And let's say there's 8 servings in there. And then you realize, well, if I eat the whole box, that's 800 milligrams of sodium. We only get 2 grams a day. So you're almost halfway there just for like eating whatever in this box. So learning how to read labels is important. One thing I tell my diabetics about is that when it comes to food, which can become a challenge because for the most part, we don't think about what we eat on a daily basis. We're like, we're hungry, I want this, and we're good. Well, with a diabetic, they'll constantly have to worry about the way that food is going to affect them and affect their blood sugar. So, like, for instance, for a person, I had this discussion today, they were talking about how their blood sugar was spiking in the middle of the night. And I was like, well, what time do you eat dinner? She's like, well, I usually eat it around 8. And I was like, okay, well, what are you eating? She's like, I mean, basically like the ramen noodles. And I was like, okay, well, you're eating a fast carb, it's spiking your blood sugar. That's why your blood sugar is going up so high. So we just got to find something healthier for you to eat before you get ready to go to bed. She came in with the expectation that we were going to change her diabetes medication. I was like, no, we just got to change what you're eating at night.
Right, right. Because people don't want to change their habits. Let's be honest.
Correct.
People don't want to change their habits, but if they know that they can, and we've become a society that where if we could take a pill to fix it, then we'll take a pill to fix it instead of doing the hard work of changing our diets or changing our lifestyles in order to be better. So
100%.
that's what happens. So here's another question. Family history. How often do people that come and visit you, whether it's male or female, know their family history and what's really going on with them?
I would probably say on a good day, maybe half. Um, the other people are like, hey, I didn't know this particular parent, so I don't know like what happened to them. So is that incomplete history that often come across. And that does play a role about what type of preventative things I may want to do for my patient, um, what type of education I want to give to the patient. Um, that becomes like the complicated part. It's like, okay, well, they don't know their dad's side of the family or their mom's side of the family. And you got to kind of like put the pieces together.
Okay. So, I mean, that was a better percentage than I thought it was going to be. You said half of the people. I thought the percentage was going to be even lower than that.
Well, that's on a good day. On a bad day, maybe like 40, 35.
Wow. Okay. Now, see, that's the number that I was expecting to hear in the first place was like 30% of the people you see, know their family history. That is, I think growing up, you hear a lot of times when you ask Big Mama or Pop Pop, tell me about the family history. Oh, you don't need to know about that. It was also, there was a lot of hidden things that they didn't want us to know. And now at our age, at our rightful big age, because I'm over the fours and a lot of my audience is over the fours, we're digging now to figure out a lot of our family history and a lot of the hidden secrets. And, I talked about the African American family secrets and how it's destroying the African American population right now because, as you said, most people don't know their family history. Therefore, they don't know that grandma's mama, big mama number two, had this and had that, and now it's affecting you more than it, than you could imagine it would be affecting you.
Absolutely. I would say, like, I'll use myself for example. Just finding out about different family members having kidney issues that I was not aware of. Like my aunt just found out that she has a disease called polycystic kidney disease
Okay.
um, that I just found out about, and then I found out that one of my brothers also had it. So I went to my PCP just to inform him and talk to him about it. He was like, "Yeah, I am glad that you found this out and that you let me know." He said, "Let's go ahead and get an ultrasound just to make sure like your kidneys are doing okay." So
Okay.
just knowing your family history will help you out with like those type of discussions to have with your PCP.
Okay, so you just brought up something that I've always wanted to ask a doctor. So
Yeah.
you're a general practice doctor, and you also have a PCP. What is that like having a primary care physician and you're a doctor? What are those conversations like, and how does that work? Being that both of you all are in the same field.
I think that first of all, it builds a sort of camaraderie, knowing that we've been through the same struggles. He's also African American, and he's 8 years my senior. That's one of the reasons why I picked him. Was that whatever's going to happen to him, he's more than likely going to be looking out down the line, and I'm 8 years behind him. So that's one of the ways, one of the reasons why I picked him. But also, like, he is a good guy. Um, I think it makes our conversation very like straightforward and to the point. It's like, yeah, like we saw the last, we already know which way this is going to go and so forth. So it kind of cuts through some of the minutia and trying to figure out, hey, what's the best way to educate the patient, or how do we sugarcoat this and so forth. Like, yeah, we don't have to do any of that.
Right,
We
right.
can we can look at it, interpret it like, okay, this is what we got to do.
All
So,
right.
like,
So,
for instance, kind of a funny story. Once I turned 40, my PCP had this conversation about checking my prostate. And
yeah,
honestly, my first thought was, no, you're not doing that. But then I realized I can't be that big of a hypocrite because I tell other men to go ahead and get their prostate checked. So
right.
I just had to suck it up and just do what I had to do and just get it over with.
Understandable.
Yeah.
That is the big dog in the room for every man. It's like I have not been there yet, but I'm pretty sure at my next appointment we're going to talk about it.
Mhm.
We're headed towards that road, and my wife asked me, she says, have you and the doctor talked about having your prostate checked? I was like, no, no, we're not visiting that conversation, but I think this next visit we're going to visit that conversation. There's a question in the text that says, is it true how we handle stress can be a generational issue?
Yes. Basically, if you want to think about it this way, what we observe as children is what more likely we're going to emulate as we become adults. So if we have role models in our life who don't handle anxiety or stress well, we're more likely to reflect that type of behavior as adults. And that can be passed on for generation to generation.
Yeah.
Um, I would definitely say that, like, if growing up, if we saw, hey, when things got rough, we turned to the bottle to help drown out our issues, we're more likely to grow up in the same way and just emulate that behavior. It's like, hey, you know what? Mom and dad did this. I'm going to do the same thing. That's how they handled their problems, and that's how they made it through.
Yeah. So here's another question: is alcoholism genetic also?
Um, I think there is some. scientific evidence to support there is like a predisposition to alcoholism, but it kind of, without getting too nerdy, the whole entire nature versus nurture environment. Like, if you have this gene, are you going to automatically become alcoholic? No. Um, you can have two people in the same household. One person can become alcoholic, the other person won't become alcoholic, and they'll have like the same experiences in the household.
Right.
So kind of a tricky question to answer. Um, so it all depends on the person and what they have available in their tool chest to deal with their problems. So alcohol could be one of them. Like, like, hey, this is how I deal with like alcoholism. Like I just completely abstain from it. I just do it socially. Hey, I just do it, but I can control it. Or some people like, hey, I just can't control it at all. Like I just need to stay away from it. So it all depends.
So another question, it says PSA test is better than the finger wave.
The PSA gives us more information. So I would say yes to that question.
What is
Um,
what is the acronym PSA stand for? Let's break it
okay,
all the way down.
sure. PSA stands for prostate specific antigen. Whenever there's inflammation to the prostate, that gets released into the blood, and that's what we can pick up when we do the blood test. Um, so normal range is 0.45 to 4.5. So it's a little bit easier to remember. Just move the decimal place over one. It can be up for a number of reasons. One, it could be something just spontaneous. The actual DRE or digital rectal exam, when they feel for the finger wave for the back portion of the prostate, that could actually make it go up. The biggest concern will always be cancer, and that depends on how high the increase is or how fast it goes up. So that's what the PSA stands for. That's becoming more in favor. Is actually my favorite thing because if I can skip the finger wave, I will absolutely do that 10 out of 10 times without any problems.
Right.
Just to keep it real.
Yeah.
Now, you do have some people where it becomes a little bit more pertinent if they have a close relative, dad, brother, who's been diagnosed with some type of prostate cancer. So that becomes more pertinent for them to receive the now
Finger
infamous
wave.
finger wave. Yeah.
Yeah.
um, but when you do the actual exam, roughly your prostate should feel about the size of a small peak. It should have the same consistency. If
Okay.
it's like lumpy and bumpy, which is what your provider is going to notice, then that would probably generate a referral to a urologist, someone who specializes in treating issues of the prostate.
Okay. Okay.
The other thing to consider is our prostate gets bigger naturally as we get older.
Okay. Good to know.
Particularly, oh, go ahead. Yeah. Particularly for men of color, what they found out when it comes to prostate cancer is that the genes that are there for the cancer are typically more aggressive. So that's why men of color have um, greater issues when it comes to prostate cancer.
Okay. Well, we don't know these things because you and me both we're in our 40s. So
Uh-huh.
like I said, my father wasn't around. I grew up in a single parent home, and there was no one around to really educate me as a man on a lot of things. And now at my age, I'm starting to learn about, like I've had the PSA test. My doctor has done the PSA test. Now that I think about it, last year he did it. He was like, I want to run a PSA test. I didn't ask what it was, but he was like, I just need to check your levels. And I was like, okay, fine. You're already drawing my blood anyways. Just go ahead and run whatever test you're running. And he was like, your levels are fine the time I saw him behind that. So, hey, it all works out. And you just have to, in any situation, you have to educate yourself. You have to educate yourself about your body because you're the only person wearing it. Nobody else is wearing your body, so you have to educate yourself about what's going on with your body and know the right questions to ask and know how to describe what's going on with yourself because I can't tell you what's going on with your body just as well as you can't tell me what's going on. Well, you could, but in retrospect of what I'm saying, You can't tell me what's going on with my body because you're not wearing it. You understand what I'm saying?
Correct. And
So
I would say one of the things that people say that you kind of have to take heed to is like, hey, I know what's going on with my body. Um, so you do have to take heed to that. And it always reminded me of what my niece's pediatrician told me once when it comes to medicine, that the medicine is in the bed, not in the test. So when people tell you something's off, I do take it seriously until I can prove otherwise.
right, right. And that's good because I've seen and heard of situations where doctors don't listen to their patients and try to. Big pharma, big pharma. Is that really true that they want to sell us on all of these pills and not holistic? But I know you're bound by certain rules and ethics.
Mm.
So speak as much as you can about that.
Yeah. So when it comes to big pharma, I would say it's like a tool like anything else. So it all depends on how you use it. I'll take diabetes as an example. There is a lot of money in diabetes research and treatment for diabetes. Um, if used correctly, I think can be a great benefit. Like we'll take a medicine. I'm not, sponsoring this medication or anything like that. Something like Farxiga. So Farxiga is a medication that basically the extra blood sugar, you basically pee it out. That's how the medication works. So you do that, you lower your blood sugar. It protects the heart, protects the kidney. That's how the medicine originally started off. What they found out was that the medication works well in people who are non-diabetics as far as those who are dealing with heart failure. So now they're even making a bigger push to say, like, hey, you can use this as a heart failure drug. So what was originally intended just to treat diabetes is now being used to treat heart failure patients. So I would say that's one example where big pharma could be of help. Um, and kind of on the flip end, depending on how you're using it, you can look at like our opioid crisis. So you look at Oxycontin, how that was originally put out as a medication to treat your pain that wasn't addictive. And it turned out that that was not true. They manipulated a lot of people to push these medications out there. And now we have an opioid crisis. So I would say those are like two ways where you can look at big pharma doing something right and doing something wrong.
Great examples. Great
Yeah.
examples. Those are great examples from someone in the medical field because a lot of times we don't get to have conversations like this with someone in the medical field unless there's something wrong with us and we're coming in to pay you. Now, with that being said, being a general practice doctor, is the money there or is the money somewhere else, or are you still at the bottom of the barrel right now?
I would say as far as primary care general in general, primary care physicians. So that would be like your internal medicine doctor, your primary care doctor, your pediatrician. As far as salary, we're on the lower end. The specialties that make the big money are going to be like your orthopedic surgeons, your cardiologists because of the procedures they do. Any specialty that's heavy in procedures is probably going to generate a lot of money. Uh, so like, your plastic surgeons, your dermatologists, stuff like that.
Yeah,
So there's a spectrum. So, if you want to consider, like, let's say a pediatrician is making $120,000 a year, that's not shabby. There's nothing to laugh
no,
at.
no, that's nothing
Um,
to laugh at all.
yeah, but like someone like who's a stomach doctor, a gastroenterologist, if they do like a whole bunch of scopes, they can easily make over $500,000 a year.
But
So
it's like
it all
it's
depends. Yeah.
yeah, but it's like that in any particular area you work in. If you're an IT specialist, but if you deal in digging into certain, if you're an IT specialist, that's just the run of the mill. I fix computers, I do this, I do that. And then you have a what is it, IT specialist that is into cyber, whatever, blah, 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 and you add something else on the back of it, of course it's going to go up because now you specialize in something else. So I get what you're saying about that. So did you go into medicine for the money or for the love of people?
For the love of people. There's a lot of things I could have done to make money, so that's not my primary concern. Um, I go back to what this OB in Detroit told me once. He told me that isn't how much money you make, is how much you spend. That's more important. So I always like kept that in mind. And ultimately, money doesn't buy you happiness. Um, so I kind of look about it that way. Yeah, do I want to? I guess ultimately, I just want to be comfortable. I don't need the latest and greatest. I don't need to keep up with the Joneses. Just be able to provide for for my family and like who's around. So that was my goal.
Yeah.
Plus, I want to
So
make a decent salary to pay back my loans. So yeah.
I get it. I get it. So here's a question from the chat. It says, if
Sure.
breast cancer runs in family, is it more likely prostate cancer will appear in a boy or vice versa that's what it says, or vice versa?
Gotcha. So, to my knowledge, there is no direct correlation between breast cancer and prostate cancer. Um, um, More likely, because they're more specific to like the gender. As far as like, hey, telling like your close relatives, like if you have breast cancer, telling their daughters and so forth, and vice versa, fathers telling their sons. Something like colon cancer tends to run in families. Other types of cancers can run in families. So those are the conversations you want to have. So that is an important component. Like, is there like a family history of cancer, and what type of cancer?
Right. Understandable. So, like you talked about Farxiga and how it was originally put out for one particular diagnosis, but then they changed the diagnosis. Does that make the price of the medication go up?
Not to my knowledge. When medications first come out, they're branded or patent. Um, I think the patents are like 15, 20 years or something like that. And then once they go to generic, usually the price will go down. But that can be a long, lengthy process, depending on, what the patent says, I believe. What generally drives up the price of a medication is what your insurance is willing to pay for it, like how they tier it. So usually, most insurances have like a tier system, like 1, 2, 3, 4. So the higher the tier, the more expensive the medication is. So they may consider like, let's say we'll take Farxiga. Let's say insurance company A says, okay, this is a tier 2 drug, but insurance company B says, no, this is a tier 3 drug. So that's what can make the price different for a person who has, for people who have like different insurances.
Okay.
So if you want to think about it that way, that may explain like the cost difference, and that can change from year to year as like the pharmacies make their arrangements with the insurance company. They may say like, hey, this is a tier 2 drug versus tier 3. They make their negotiations, and that's what set the price. So that's what can make the price of medication change from year to year.
Okay. So we're almost at the end of the show. We got a little more time left. If you could make a plea, because most of my audience is African American gentlemen, if you could make a plea of any sort to tell men how important it is they are and their health is, what would you say?
I would say to them, make health a priority. Um, Even if you think nothing is wrong, there's nothing wrong with going to your doctor just to make sure that you're confirming that nothing is wrong. Um, I don't get compensated any less for a wellness visit versus a sick visit. So don't think we're out here to like do like a money grab or anything like that. But in all seriousness, you do want to make sure that you're making the best informed decision for not only yourself, but also for your loved ones. You want to make sure that they are aware of what's going on with them, that there are, less of those family secrets going on in the family, and that you can be around. Like you pointed earlier, you want to be around for your kids. You want to be around for your grandchildren. You want to be able to enjoy them in the best health that you can. Um, on a more religious note, we are, our bodies are God's temple. He designed it for a purpose, and you want to take care of that. So that'd be like another aspect to look at it. We just want to take care of what God gave us. So we got one
Amen, my
shot with
brother.
this body. Yeah, we got one shot with this body. So get it right.
Amen, amen, amen. Hey, I get it. Well, you right. We only got one body and we got to take care of it. All righty. So we've got a lot of the business out of the way. So now what I do is I ask a few questions. It's nothing too personal. It's nothing over the top, but I like to ask questions. If I was to get into your vehicle right now, what would be playing on the radio?
92.1. I believe Kenny Smooth was still on. The
Kenny
last
Smooth
song
in
went
the
on was,
morning. Shouts out to Kenny Smooth Show, the
yeah,
KMS, man. I listen to it every morning.
yeah.
What
I think the
is,
last song was Lauryn Hill.
oh, okay. What is Dr. Crayon's sweet indulgence?
Say that again. The audio broke up.
What is Dr. Crayon's sweet indulgence?
Anything with cookies and cream.
Anything with cookies and cream. I got you. Okay. So the next question is, if you could describe your perfect boo, how would you describe her?
Um, Faithful, God fearing, intelligent, fearless.
Man, I love it. I
Mhm.
love it. I love it. So, what would be the perfect vacation for you?
Anything with a beach. The
Anything with a beach.
blue crystal clear water, white sands. Yeah,
Okay, all right. I get it. I mean, you're hitting the mark, man. I love your answers. I always ask men to describe their perfect lady. And, here recently the answer has been spot on. Instead of it being physical, everybody is looking for more internal nowadays. And I love that. I love that we're getting away from the physical aspects of what someone looks like, and let's focus more on the internals, because the physical is going, and that's what a lot of people, young people, miss. The physical is going to change. At some point in life, the physical is going to change, but the internal, 9 times out of 10, stays the same.
absolutely.
Yeah. So, Dr. Crayon, Mahari, what's if you want to give out some, what is your Insta, what is your Facebook, if you want to give out any contact information, here's the time.
Oh,
Just
sure.
tell us where we can find you at.
Okay, you can find us at I'm trying to think of our full title now. Nashville General Hospital Metro Center. Our telephone number is 615-254-9981. Again, that's 615-254-9981. I work with another good physician, Dr. Melvin Leifer, and a wonderful nurse practitioner, Van Stroman. We're getting new services added to us. We already have our in-house pharmacy. We have an in-house physical therapy, occupational therapy. We're going to have a behavioral health specialist joining us next month. So we got a lot of things to offer at Nashville General Hospital Metro Center.
Listen, it sounds like you got an office full of gentlemen.
Trying.
But that's nothing wrong, because that's more encouraging for a man to come in. If I can come in and talk to a man who understands the plights of life that I'm going through and can help me diagnose it and feel better, I'd feel better. Like I said, my doctor is a male, and we get along wonderfully. His nurse practitioner is a male. You know what I mean? So we have that camaraderie. And something you said a long time ago in the conversation, when we get together as men, and everybody reference to the barbershop, I always
Hmm.
say it's fluff. We get together and we talk about fluff. We never talk about the real issues at hand: mental health, uh, erectile dysfunction, diabetes, high blood pressure. What's going on with you, brother? Why are you slumped over? Why is your feet hurting? Why is your back hurting? Why is your skin looking like that? We don't have those real conversations. I guess it's bravado or whatever it is. The male ego just keeps us from taking care of each other. But if we don't take care of each other, who's going to take care of our sons?
Absolutely.
My son came to me a month ago and he says, "Pop, I don't want to go to my pediatrician no more. I want a real doctor." So I referred him to my PCP.
Huh. Okay. That's very interesting coming from a 14-year-old.
No, my daughter's 14. My son's 20.
Oh, okay. Gotcha. Okay.
I have
My bad.
5 children.
Okay,
Yeah, it's
gotcha.
okay. Listen, I have 5 kids, 4 girls,
Yeah.
1 boy. The 2 older ones are girls, the one in the middle is a boy, and the 2 younger ones are girls.
Gotcha.
Yeah. So he's 20. He's 20 years old. And then the 2 younger ones are girls and the 2 older ones are girls.
Gotcha.
But yeah, so yeah, I'm trying to make sure that he understands that health is wealth.
Absolutely.
He's 20. He's healthy. He's vibrant. He's a man's boy. You know, he's out here in the streets. He's got a job. He's been in the same job for 2 years. You know, he's dating. He's doing all these things. We have conversations about health and in relationships and all those things. So I try to educate my son the best I can to understand. Like I said, nobody's wearing that body but you, son, and only you can mess it up.
Correct.
Yeah. But I want to thank you for being here. And as I say to everyone, we do a show. This is Topic Tuesday on the Kickback, a place for brothers. But we also do a show on Fridays where we call Freestyle Fridays, where we have open conversations. It starts at somewhere between 6 and 7 o'clock. It all depends on how my schedule runs. And it's just an open forum for men to come in and talk and have conversations about various things. And I invite every guest that comes on my Topic Tuesday to come in and check in. From here, you may get a random text message. And if you can come in, come in. If you can't, you don't have to talk all the time. You can just come in and listen to the conversation. And if there's something you feel like you want to speak on, you speak on, because it's usually a panel from anywhere to from 5 to 9 gentlemen, ranging from the ages of 30 to 65, on the panel, just talking about whatever. I always extend that invite to everybody. Again, thank you, Dr. Craion. I wish you the best, my brother, and God loves you and we love you. And I'll probably come see you one day, but it ain't gonna be for that. But just to so you can put a face with the name, because I love to come and meet all my guests in person. I meet a lot of my guests randomly sometimes. I'll just be out and I'll hear a name and I'll be like, "Hey, that's so and so," and you may get a guy that just walks up and say, "Hey, you remember that podcast you was on? Well, I'm him. I'm the host."
Gotcha. Thank you so much for the invite. Thank you, Brother Van Cliff, to your listening audience. It was a pleasure. And yeah, I'll definitely look into checking in on Fridays. So just let me know.
All righty, thank you, sir.
Okay. You guys have a blessed evening.
You have a blessed one also.
The kickback, the place for brothers. Yeah. brothers. Yeah. The kickback, a place for brothers. Yeah. The kickback, a place for brothers. The kickback, a place for brothers. The kickback, a place for brothers.